A lot of women, men, girls, boys, they recommend breast milk to people who have red eye, any issues with their eyes, basically. We're going to talk about it today. If it's the right practice, if it is the right thing to do, or if it is not. So, by introduction, we'll start with what breast milk is. So, breast milk is, we all know what breast milk is basically, but then it's the essence of it is to feed the child. You know, when you give birth to a child, a new child, you can't give the child normal milk. You can't give the child eba or rice or whatnot. The food you eat basically as an adult. Yes. So the child depends solely on breast milk for a while before his whole system grows to adapt to the food in the like readily available. So first, the first essence of breast milk is to feed the child. Yes, to feed the child, so the child won't be hungry and all of that. Take care of the child. Two, to provide immunity, good immunity for the child, to boost the child's immune system. Yes, to ensure also that the child's organ tissues grow. Do you understand? Yes. It's just to ensure the general well-being of the child. And breast milk, as you well know, it contains lots of constituents. It contains both micronutrients and macronutrients. Yeah. This video is not basically to talk about the constituents of breast milk, but I'm just going to highlight some of the nutrients or some of the constituents of breast milk that should make you not use breast milk for your eyes. So first of all, breast milk contains lots of carbohydrates. By carbohydrates, I mean glucose, and the glucose is in form of lactose. Breast milk contains a whole lot of lactose. Yes, a whole lot of lactose. Breast milk also contains fatty acid, form of triglycerides, linoleic acid, contains alpha linoleic acid as well. Contains growth factors. Breast milk contains lots of growth factors. Then also, breast milk contains a good percentage of water. It also contains lysozymes and other nutrients that will help the child fight against diseases or to build the child's immunity. Basically, lysozymes definitely yes helps to break down bacteria and anything that the child's body does not need. So I'm trying to make this video as explicit as possible to the layman, to everyone, so that you would get the message what we are saying basically. Breast milk contains vitamins as well. Now we're going to talk about the eye. Yes. On a separate video, I'm going to explain to you the features of the eye, especially the external part of the eye that you as a layman should know and should reckon with when you hear those things. But today we'll talk about generally the eye. So the eye contains the white part, which is the sclera, and then the part that looks black, it looks black, although it is transparent. It is the cornea. So basically, other structures, well, look out for these two for now. So the eye can get red at any time. You've seen people complain, oh, my eyes are red, or something's coming up from my eyes, or something's happening to my eyes. The eyes can get red anytime. That's because a lot of things can stimulate any structure of the eye, which can cause your eyes to get red, to react to those things. Yes. So most of the time, when people recommend breast milk to others to use, is when they notice that okay, their eyes are red, or there are discharges from their eyes, whitish discharge, ropey discharge, water, a lot of things. So people recommend breast milk when they notice all of these things. Things that can cause this discharge and redness are bacterial infection, it could be a fungal infection, it could be a viral infection, it could be an allergic reaction on the child's eye or on the human being's eye, the person's eyes. Yes, there could be a tear on the cornea, there could be an injury in the eye, there could be a foreign body on the eye. A whole lot of things can cause your eyes to get red. A whole lot of things, a host of them can cause your eyes to get red, can cause you to have those discharges and all of that. So yes, your eyes could be infected, you could be having conjunctivitis, uveitis, scleritis, many things, so many things, yes. And people now recommend breast milk when they notice this abnormality with the eyes. Yes. So now the answer to the initial question I asked you is no. You should not use breast milk on your eyes. You should never use breast milk on your eyes. There are lots of schools of thoughts, a lot of articles on the internet which recommends breast milk and say, okay, apply breast milk on your eyes for prolonged use and all of that. It is not ideal. From an eye doctor's point of view, breast milk is not ideal for your eyes. So when your eyes have discharges, maybe whitish discharge or redness, like I said initially, it could be because of bacteria. It could be a bacteria infection. Yes, and you see, this bacteria, they have this love, this affinity for sugar, glucose, lactose, all of those things. They have this affinity. They want, just like a human being, for you to grow, you need to eat. You need to have glucose, protein, fats, vitamins, minerals, water, many things for you to be a whole human being, for you to grow. These bacteria, they need these things. Yes, they actually need these things to grow. So now your eyes are now infected. You have this bacteria on your eyes, and then you're now giving this bacteria glucose. You're giving this bacteria food. Do you understand? So when you give this bacteria food, what do you expect of them? They'll grow. Yes, this bacteria will flourish. They'll grow. They will, oh my god, they will be so big. Like, they are going to grow. And the more the bacteria grow, the more issues you're having with your eyes. And if you're not so lucky, if your cornea is lacerated, or by cornea I mean the part of the eye that looks black. Yes. So if there is an opening, even if it's a small microscopic opening on your eyes, and this bacteria now grow, there is a class of bacteria now that loves the cornea. Like, oh my god, it loves the cornea. Yes. And the cornea is a structure that does not have blood vessels directly. It doesn't have blood vessels directly. It is transparent. Yes. For it to be transparent, it doesn't need blood vessels or anything. Do you understand? Any little thing like this, film that affects the cornea, it goes opaque. By opaque, I mean it goes white, whitish. Exactly. It goes very white. And when the cornea is opaque, when it is white, there's no solution, there's no remedy except you have a cornea transplant. When somebody, maybe a dead person, donates his cornea to you, and then they transplant it to your own cornea. That's the only way there's a remedy. And when your cornea is opaque, there's no vision, you go blind totally. Do you understand? So if there's a minute tear or a microscopic tear or even an obvious tear on your cornea and you apply breast milk, those bacteria, they rush into the eye, the cornea goes opaque, they infect the whole eye. At the end of the day, the eye goes blind. Yes, you go blind. Do you understand? So you could be standing the risk of having an endophthalmitis or a panuveitis or a panophthalmitis. Yes. So you don't want all of those things. You don't want those uveitis. You don't want a choroiditis. You don't want a retinitis. You don't want your whole eye to get infected, because most of the time, when those things occur, the patient loses the eye that is affected. You do not want to lose your eye. Do you understand? Breast milk puts you at the risk of getting blind. You should not use breast milk if you don't want to go blind. You should not use breast milk if you don't want your eyes, the infection on your eyes, to increase. Blindness is not something you should hope for. You don't want to test blindness for one day and say, okay, let me just try blindness today and see what it feels like. You do not want that. You don't want that at all. You should also know now that we've seen traces of HIV in breast milk, human immune virus in breast milk. So imagine you having an infection, maybe a viral infection in quotes, and you pouring more virus on your eyes. Imagine you having a bacterial infection and you pouring more sugar on your eyes, more glucose on your eyes. You having a serious eye issue and then pouring breast milk on your eyes and losing your vision at the end of the day. You don't want to risk going blind. So avoid breast milk. Tell your friends, tell your brothers, tell your sisters, tell your church members. Teach people not to use breast milk on their eyes. The ones who champion the use of breast milk, encourage them, show them this video, teach them not to use breast milk on their eyes. A whole lot of research has been done, and it has revealed that over 26% of blindness is as a result of corneal opacity due to the use of breast milk and traditional eye medications. Yes, and that is true. So you don't want to go blind. If you have an issue with your eye that is charging red and all of that, what you should do is to visit an eye clinic. Yes, visit an eye clinic and get treated. Visit a hospital that has an eye doctor for you to get treated. Do you understand? Don't just walk to a pharmacy and just buy drugs, because there are eye drops too that could cause you more harm than good. There are eye drops that are contraindicated for certain eye issue. For instance, you have so and so problem. There's a particular medication you should not use because it could increase that problem and cause you even vision loss, more damage. Do you understand? So you don't want to just go about getting any eye medications, even if they tell you okay, it's an eye drop or it's an eye treatment. You don't want to just go about using them because you don't know what that particular medication is for. I hope you've learned a lot. Do not use breast milk on your eyes. Avoid using breast milk on your eyes. Teach your friends not to use breast milk.